And then you know her as the former host of The Doctors. Dr. Lisa Masterson is here to tell us about how she's helping women with her mobile mom squad and how you can help too. We'll be right back.
According to the World Health Organization, about 830 women die from pregnancy or childbirth-related complications around the world every single day.
And here in the United States, every year, 1,200 women suffer fatal complications during pregnancy, and 60,000 suffer complications that are near fatal.
Our next guest says if more women were to have access to adequate health care, most of these maternal deaths could be prevented.
We want to say good morning and welcome back to the show to OBGYN and former co-host of The Doctors, Dr. Lisa Masterson. Good morning. How are you?
Good morning. I'm so thrilled to be here. Thank you so much for having me. And yes, it is actually so distressing. 1 in 5, so 20% you said earlier, 1 in 5 infants are born to mothers who haven't had any prenatal care. And this really increases the maternal mortality rate when women don't have consistent health care. And globally, that number, the maternal mortality rate, is actually going down, whereas here in the U.S., the problem's right here at home. Here in the U.S., it's actually doubled and gone up to 56%.
Why do you think that is?
That because they can't get to a lot of is prenatal care. It's a social and economic thing. Women can't, when they sign up for Medicaid, they may sign up late because they didn't know they were pregnant, and then they've got all this paperwork to do, or they can't afford it. A lot of women are afraid to go if they're teens. There's a lot of distrust of physicians, so we've got to do a better job with that. A lot of women are worried about if they're on drugs or something like that, that they're going to be turned in, or that their babies are going to be taken away. So there's a lot of factors that go into women, going for prenatal care, and this could really, really save lives for the mothers and the babies.
You're talking about the paperwork and all of those things. Is there a way to simplify all of those things? Is the medical community trying to do research development, trying to make it easier?
Not right now, and I think that's one of the things we need to work on is how can we make this more accessible, more friendly? How can we help our mommies out there? Because if we help our mommies, we help the whole society. And it's really, really important that we, make this a lot better for all the women out there.
Tell us about the Mobile Mom Squad. That's what you're here to talk about.
I thought you'd never ask.
Yeah.
Also, Mobile Mom Squad is, we used to go out internationally to try and decrease maternal mortality. And now we find out, here we're one of the worst countries, as opposed to other developing countries as far as maternal mortality. So we decided to focus here, and we've been going to clinics, we've been going to pregnant homeless shelters, Indian reservations, we've been giving supplies, educations, we've been going to high schools to try and help with teen pregnancies and things like that. All supplies are needed, and basically we get in our little Jeep there and we go to where we're needed and try and see what the problems are. And it's really been a fact-finding mission as well as helping. I mean, even just things like formula, diapers, baby wipes, all those things are needed.
First of all, who qualifies, and then how are you getting the word out to these neighborhoods?
Well, on our website, which is mobilemomsquad.net, they can go there and find out, different resources in the community. So we're trying to network people so that they know, especially if they're in homeless shelters. And really, that's what we've been trying to do, is just going on the show and trying to let people know that Mobile Mom Squad is out there to help you get prenatal care, help you get supplies and education. And the beautiful thing is we've joined with Duchenet USA, which makes prenatal vitamin. They have donated over 20,000 boxes today of prenatal vitamin supplements for these women, which they need to take before, during, and after pregnancy. And postpartum care is really important as well.
Those are the boxes that your workers were putting into the Jeep that
yes,
we saw a few seconds
over
ago.
20,000
Wow.
have gotten to them. It's huge for babies' health.
Yeah, and you didn't have to do this, so thank you for doing it. Yeah.
Well, I'm an OBGYN, so
yes, it's your
women's
passion.
health care is what we do, and I think every person right now, especially the way the world is today, just if we all just pitch in and help, we can change the world.
Yes, amen. All right, thank you so much. We really appreciate it. And for more information on Dr. Masterson and her Mobile Mom Squad, great name too, you can log on to the mobilemomsquad.net, or you can call the number there on your screen, 310-458-8190. And of course, KTLA.com has additional information. Thank you again.
Thank you.
Great work, great work.